Welcome. Today we will be talking about the shocking health consequences of childhood obesity. Most adults know that obesity in adulthood carries some serious health risks. However, it's not enough to simply avoid being obese as an adult. Today's children must be educated about the potential consequences of childhood obesity as well so they can take action to prevent them before they become adults. It's sad, but true. Childhood obesity has reached epidemic proportions in America, and it's causing serious health problems among young people today. Here are the shocking health consequences of childhood obesity. 1. A consequence of childhood obesity is diabetes. According to the CDC, obesity puts children at risk for type 2 diabetes, which was once known as adult-onset diabetes. But now, more and more children are being diagnosed with this disease. In fact, 1 in 3 American children born in 2000 will develop diabetes in their lifetime. And it's not just type 2 diabetes that obese children are at risk for. 2. A consequence of childhood obesity is heart disease. Childhood obesity is a major problem in the United States. Heart disease is the leading cause of death in the United States. Obesity puts children at risk for heart disease by increasing their chances of having high blood pressure, high cholesterol, and diabetes. These conditions can lead to a heart attack or stroke. 3. A consequence of childhood obesity is cancer. Childhood obesity can increase a child's risk for developing cancer. In fact, one study found that children who are obese are 4 times more likely to develop cancer than children of normal weight. The good news is that childhood obesity is preventable. By making healthy lifestyle choices, parents can help their children avoid the health consequences of obesity. 4. A consequence of childhood obesity is having joint problems. One example is that the knees may not develop properly, which can lead to arthritis later in life. Obesity can also put stress on the hips and lower back, which can lead to pain and mobility problems. To avoid these consequences, children should be active at least 60 minutes per day. In addition, it's important for parents to model healthy behaviors by limiting their own intake of unhealthy foods and being physically active themselves. 5. A consequence of childhood obesity is liver disease. In fact, obesity is the leading cause of non-alcoholic fatty liver disease, or NAFLD, in children. NAFLD is a serious condition that can lead to inflammation, scarring, and even liver failure. While it's important to watch your child's weight for many reasons, this is one of the most serious. Childhood obesity doesn't just change how you look or feel about yourself, it changes your life. 6. A consequence of childhood obesity is having psychological issues. Among the most frightening side effects of childhood obesity is the psychological health ramifications. Obese children are more likely to experience symptoms of anxiety and depression, and have low self-esteem. They may also be ostracized or belittled by their peers, which can lead to additional psychological trauma. Studies have shown that obese kids show a greater number of problems with attention, concentration, and impulse control than other kids. These issues affect academic performance as well as mental well-being. 7. A consequence of childhood obesity is asthma. The CDC has identified that childhood obesity can lead to a number of medical problems, including asthma. For example, in one study, obese children were found to be more likely to develop asthma than their non-obese counterparts. That being said, while asthma is a serious condition that can be fatal, it is also one of the most easily preventable childhood diseases. By teaching your child healthy eating habits and encouraging them to be active, you can help them avoid this potentially life-threatening condition. Well, that's it for today's video. Thanks for watching. Make sure to like, comment, and share the video.